I've always had an interest in psychology, so I started studying psychology when I was 14 years old, and that's when I was in year 11 in high school. And after high school, I just found it a really fascinating subject, so I continued it at university. Like most people, I found that my first year at uni was pretty hard, adjusting to the new schedule and meeting new friends. And as a result, I slipped into severe depression and anxiety, and eventually that led to an eating disorder for me. So I experienced that for a number of years. I was eventually hospitalised with an eating disorder, anorexia, and when I got out, it wasn't all rainbows and butterflies. I still had a really long way to go, and I participated in several years of therapy, group counselling, and many programs to actually help me get on my feet. That really inspired me to get into the space where I wanted to conduct research and help other people. So I wanted to learn research skills, and that's what I've done through my PhD. And then recently I've gotten into the social entrepreneurship space to develop new ways to help people get better access to the help that they need. There's a few different ways that you can improve mental health in Australia. In fact, there's many ways. I guess the most essential thing is people being aware of mental health problems and what people need who are going through them. Another one is reducing the stigma associated with mental illness. So with awareness, you can be aware, but you can still hold prejudice, negative attitudes toward people who experience mental illness. So what we need is a change and a reduction in that stigma, which will allow people who, say, live with a mental illness and work to actually get the help that they need to keep on working or to function in their daily lives. We also need better access to psychological therapies and other forms of help for people who live with a mental health problem. Many of these are unaffordable or unobtainable, and there's many specialist services that aren't available to people who are going through mental health problems. So for me, for example, when I was going through my mental health problem, I lived in Canberra and I needed inpatient hospitalisation, but there's no hospitalisation available for people who have an eating disorder in Canberra. So my family actually moved to Perth to get the treatment that I needed. You shouldn't have to travel across the other side of Australia to get the help you need for a mental health problem. So we need improvement for that. And then on the other side, we also have a really fragmented mental health system. So people who have mental health problems, they don't only just need mental health help. They might need financial assistance, housing assistance. They might also have chronic physical conditions. So we actually need to have a better, less fragmented system to enable people a holistic way of caring for themselves. We know for a lot of people who experience a mental health problem, the majority of them do recover with timely and effective help. Mental illness has a massive disabling effect on people's lives. It really can't be underestimated. If you lived with chronic diabetes or cancer, there's also a similar impact, and studies have shown this, to the disability it creates in a person's life. It literally affects their ability to function, work, family, relationships. Every aspect of their life is dominated by the mental illness. So by alleviating that and helping people get timely and effective access to services, we can dramatically reduce the impact that it has on their lives and get them to a place where they're able to work, where they're able to have satisfying relationships and they're able to function. Mental illness also puts people at risk for physical illness, for premature death. So by actually getting people the help that they need, we can reduce those risks, and that can have a massive positive impact on people's livelihoods. As individuals, helping somebody with a lived experience of mental illness, I think it starts with creating a non-judgmental space for them to talk about what they're experiencing. So we don't want to bully, harass, or tell people to get over it or it's just a phase. Those things aren't actually helpful for the person who's going through something that feels really real to them and quite distressing. The best thing we can do is listen non-judgmentally, give them support and information, encourage them to seek appropriate professional help, and then encourage them to seek other support. So that might be going and joining a club or learning something new, but it shouldn't just be try yoga. It should just be, with timely and effective help, in addition to, say, doing yoga or other exercise, that can be really helpful for a person. Individuals are really important in shaping our mental health system of the future. So increasingly, organisations are creating reference groups of people who have a lived experience. So these are just everyday individuals who might have some connection with a person who has a lived experience. They might not have experienced themselves, but they've still got a voice, and that voice is really important. And recent reports that have been released from the federal government say that person who has a lived experience and their carer and friends and family around them have an instrumental role to play in the future of our mental health system. So we can certainly write to our local members and ask them what they are doing for mental health, but we can also support major organisations that have an influence in this space. So I guess the big players are probably Beyond Blue, Black Dog Institute, Origin Youth Mental Health, and these are all major research institutes as well, and they have a variety of programs. So you'll see a lot of smaller organisations who give their funding to these larger organisations so they can carry out really good trials of programs to help people directly who are affected by mental illness. So for example, I was just reading one then, Beyond Blue is conducting a suicide prevention study, and that's funded with profits from Movember, which is men growing moustaches in November. And that's a really good way to give back. So we can support research, we can support programs in our local community that help people. And that's not only mental health services, again, it's homelessness services, domestic violence services, it's education services. These are all factors, social factors, that help prevent mental illness in our community. A big reform that the government released last year was introducing something called primary health networks, and it's actually essentially to replace Medicare locals, which provided people with a variety of health services. So the idea is that primary health networks receive the funding and then they distribute that to people. I've spoken with a few psychologists and key players in the mental health system, and they say that this could potentially leave people who see specialised services and who also need an increase in the severity of care that they need, left with nothing. So currently right now people receive 10 Medicare subsidised psychological sessions through the Better Access to Psychological Care program, and that's in that program. So people who say use their 10 sessions of these sessions, they might need a higher degree of care in the future. But if the primary health networks dish out this funding and they say, yep, we've given you your 10 sessions, there might not actually be enough left over, say if this person needs hospitalisation or if they need more psychiatric care, if they need medications, and this could leave a lot of people left in the lurch. So a lot of people slip through the cracks that way. So that's a major fear. Another area which the government really needs to improve in is with a Better Access to Mental Health program. In 2011, I believe, it had 18 sessions that people could access. And this was in line with research showing that people need a minimum of about 18 sessions of care to reduce their risk of relapsing and experiencing mental illness the next year. This was cut down to 10 sessions in 2012, which is really disappointing because that's really under the amount of care that people need. So this is 10 sessions in a calendar year. If you use them all up in the first 3 months, then you have nothing to let go on for the rest of the year. And it can't be reinstated into the next calendar year. This leaves people who have complex conditions, for example, trauma or complex psychosis, left in the dark again. And this leaves people who also have who are of low financial backgrounds in the dark as well. So we need more affordable, we need extended sessions for people who can't pay $220 per session for a psychologist, and that would help a significant proportion of people get the help that they need.